I'm a rural family doc at heart. When I graduated from residency, I was a young 29-year-old, and going to my rural community, my rural hospital, critical access hospital CEO said, "Dr. Schmitz, we need to get your name out there. How about writing an article in a local newspaper?" And so that's where the Targeted Rural Health Education Project came from. We want to put a learner in a position where they can help facilitate that community's own success in addressing that health need that's sort of targeted in the sense that it's a high priority need for that community, and empower that local providers and maybe work with the local newspaper, for example.
The TRHE project is a collaborative effort with support from the North Dakota Center for Rural Health, the North Dakota Rural Health Association, and the University of North Dakota School of Medicine and Health Sciences, Department of Community and Family Medicine. The project involves choosing a targeted health topic, using health literacy principles, writing in plain language, and engaging with the rural newspaper to disseminate information.
I think the TRHE article was really good at kind of breaking down the barriers of learning from a textbook and bringing it to working with actual people. Being able to communicate effectively to an actual person and not to a PhD or a fellow student has been really helpful. It's kind of, you learn the language in one way, and now I get to actually translate that back into normal speech, and I appreciate it.
I think the biggest thing is just getting used to really kind of thinking about us as not just physicians in the hospital, but really physicians in the community. And so I think kind of learning how to develop those skills, be it, speaking at conferences or schools or, local functions, or writing in the paper is such an easy way to reach out and address the community.
I've also learned that having a good writing mentor impacts the students so much throughout this process. Those who don't love writing will still come to appreciate the process through our writing mentor's guidance and thorough feedback.
So my role as the writing mentor is centered in two areas. First, reminding the students that the language of healthcare professionals is a jargon-packed language that isn't very well understood by either their patients or the lay public. The second area, and this is so core to the principles of the health literacy that we're trying to teach, is getting the students to translate their jargon-packed language into the plain language already spoken and understood so well by their patients. How do we accomplish this? Draft by draft, the student writes a draft, and I provide pretty detailed feedback based on the needed plain language changes.
Something that we talk about often is health literacy, and basically speaking about healthcare in terms that everyone can understand. And I think especially when we're absorbed in residency close to many other people who are at the same level of training as us, it's easy to get lost in that. And I always compare that to if two engineers were talking, I wouldn't have a clue what they were talking about unless they kind of brought it more geared towards what I understood. So I think that was very helpful when we sent the drafts back and forth to each other and talked about how to make something more understanding and not use some technical terms that nobody should know unless they're in medicine. So that was very difficult, but rewarding as well, and something that I keep in mind through my residency training.
One of the most important and crucial moments in a provider and patient interaction is the conveyance of a diagnosis or the conveyance of a treatment plan. And it's really easy for us as providers to use jargon because it feels more efficient. Maybe we feel like we sound smarter if we use doctor talk, but a lot of that can be lost in translation. And I feel like I've had experience where I don't do as good a job at conveying in plain language what's going on, and I have experience where I feel like I've done a better job. And the relationship between me and my patients, it definitely improves when I'm able to accurately describe what's going on.
My two roles with the TRHE project as the coordinator are to introduce students to the project at the beginning, and then coordinating with rural newspapers once their article is completed, making sure the newspaper has everything they need in order to publish that completed article in their rural newspaper.
Stacy contacted me a couple years ago to ask about publishing the articles for the students that come to Hettinger, and I didn't even question it. I said, absolutely, I think this is something that the community would love to read.
And I think this program does a good job in addressing the literacy aspect of it by breaking it down so that my son who's in, 7th grade can read it and understand exactly what it is that's being said. I think it provides some quality, fact-based, well-researched health news or educational pieces, features to our readers.
It provides a source of information for us to reach our readers on topics that are important to them.
The biggest surprise to me has been how receptive the community has been to this, and the amount of feedback really that I've gotten on it, because I've been stopped on the street and said, oh, I read that article, thank you for publishing it. We've received messages on our Facebook about, thank you for publishing educational stuff as well as this other local hubbub. So the positive response really has been my biggest surprise.
They're well received and they're well liked, and I've had readers reach out and ask me, why don't we publish more of that? I think it also acts as a catalyst for a lot of younger rural people who otherwise wouldn't think about pursuing a medical profession.
Anything that can be done to make young would-be physicians, soon-to-be physicians, get kind of excited about working in a small town, I think the newspaper plays a role in that. And if they'd like to see themselves published, I think what that also leads to is maybe when they do become a full-fledged physician working in a small town community, they'll write about their community. They'll write public health information stories for their community. That's what we're looking for, I think, and I think that's where we benefit by working with the program.
And we've also learned that rural newspapers absolutely love getting TRHE articles because the content is relevant and well presented, and because they know the importance of good communication about health topics in their community.
And a lot of the times it takes a lot of editing and effort and time to make sure that the information that we're putting out there is accurate. And what surprised me the most about the program was just how well written this was, how fact-based it was, and it took very little additional effort on our part to provide what I think is a great service.